This is a super unusual setting where we've got the director, Bruce Wong, here in attendance, the president of the City Council, Elaine Clegg, and myself, and then everybody else from ACHD and the City Council joining us remotely. Good morning to all of you on the screen. I'll go ahead and call the meeting to order, and I'm asked that we, from our end, we do a roll call for city attendance, and then Madam Chair, will you do the same for ACHD attendance?
Absolutely.
Great, thanks so much. Clerk, will you please call the roll?
Agents.
Here.
Clegg. Halliburton.
Here.
Sanchez. Thompson.
Here.
Woodings. 4 present, 2 absent.
All right, I will now open the ACHD Commission meeting and note for the record that we do have 4 commissioners in attendance: Commissioner Baker, Commissioner Hanson, Commissioner Goldthorpe, and myself. I'm not sure if Commissioner Arnold is in the building or may just be signing on here shortly.
Madam President, I just wanted to say I have a doctor's appointment fairly soon, so I will not be here for the entire meeting.
Thank you, Commissioner Baker. Thank you for having us.
Thanks so much for joining. It looks like we have introductions on the agenda first. I imagine that's because we have some new council members as well. And so this is the first meeting that we've had as 2 entities since new council members have joined. And then perhaps people in the that are here in the audience as well, staff-wise, will take some time to do that. But I'm happy if anybody from council first, since I'm here and I'm starting things off. If anybody from council wants to say hello, please feel free to do that if you've got anything you'd like to say before we kick off the business of the meeting.
If I can kick off real quick, I'd just like to say hello. I'm excited that we're meeting again, Ms. Elaine. And I think there's a lot of things that we can work on collaboratively. I think this is a great time to do it. So welcome everyone to our chambers and welcome everybody online. Thank you.
And Clerk, will you please allow the record to reflect that Councilmember Sanchez has joined us?
Madam Mayor, Commissioners.
Yes,
Councilman. Yes, I suppose the introductions are in order. I'm Patrick Bajan. It's nice to have met most of you. It's nice to meet you and see you again virtually, and I'm looking forward to getting some work done today.
Well, and I'll echo the council president's comments. You know, this is a unique time. It's great that we're all able to have a joint meeting to figure out ways that we can work together to provide services effectively to our residents throughout the city. And of course, the commission thinks even more so about the county. But as you'll see in the meeting today, while dealing with pandemic, we're making daily decisions as both agencies to run a city, run a highway district. Our staff is working incredibly hard to innovate in the ways we deliver services now. And I too share the belief that there are many things that we can work on together, some of which are on the agenda today for discussion. So welcome everybody. All right, with that, the next item on our agenda is the COVID-19 response and experience. We're going to have presentations from both the Highway District and City of Boise. It looks like Director Wong, you'll be presenting for ACHD, and Mallory Wilson. Oh my gosh, I didn't recognize you in your mask. Because I only see you on Zoom. Mallory Wilson is here to present on behalf of the City of Boise. Director?
Good. Well, Madam Mayor, President Clegg, thank you so very much for the opportunity to share some thoughts. I still haven't found the leadership book yet written on how to deal with pandemics. So I want to thank you both for your leadership in what you're doing for Boise. And I also want to thank you again for your support for my family on the events that we've had to go through. So again, I greatly appreciate it. If I could have the first slides up, I see it. Stacy, go ahead with the next one, please. What I want to do is right off the bat tell you where we are right now, and it's a great opportunity to share experience. First off, the Ada County Highway District is open for business across the board. As a matter of fact, we never fully closed from day one. We were still able to provide emergency services as required. We are currently in phase 3, and it's completely aligned with the governor's orders, CDC, Central Health, and of course, Boise's declarations of phase operations here in Boise. So we've made sure that we are absolutely in line across the board with all of the leaders' recommendations on pandemic operations. We continue to maximize work from home, telecommunicating, all the different things that we should be doing during this pandemic. And we've learned a lot of lessons, as I'm sure the city has also during this issue. You see the expenses that we've incurred at this point for the pandemic, and we have partnered with the Ada County Commission. As you know, the federal government has authorized reimbursements through the state for pandemic COVID-related expenses. We approached as a taxing authority, we approached Ada County, and they have agreed to support our reimbursement requests. And this is where we are today, and I'll have a little bit more as we go through the presentation for you all. Next slide, please. Okay. As background, we were designated an essential operation, essential business by the governor on day 1. So as we approach this, again, there is no leadership book on how to run pandemics. But one of the things that a couple of things we needed to do immediately was address the uncertainties within our team members. We established off the bat maximum communications on a daily basis with everybody at the Ada County Highway District, from our president of the commission down to our newest member of the team, to make sure that they were fully informed of every step that either the commission or I was taking in our initial responses to the pandemic. Our first priority, as I'm sure it was yours, Madam Mayor, was the safety of our team members and such. So we locked down everything except non-emergency operations, and I'll get into that too a little bit, which again went back to addressing the uncertainties, what's going to happen. We did maintain, we were in close contact with the governor's staff from day 1, based on being deemed an essential business operation, as to what capabilities they believed, and of course our commission believed, was important. And those were traffic maintenance operation, response and emergencies, our traffic management center operations, to not only support the district, but to support emergency responders across the entire spectrum in their work during this time frame. We also maintained our commuter ride operations. We scaled that back dramatically based on the governor's orders, but the same token, we were able to support those essential businesses, emergency responders, hospitals, Gowan and Mountain Home Air Force Base, when it came down to moving people. And it was incredibly successful. And of course, we had to maintain all operations when it came to environmental and permit activities. What you saw out on the roads on these initial days was a lot of our sweepers maintaining air quality requirements and the NPDES permitting requirements that we have to maintain. It was an interesting challenge on how we did rotational operations to ensure that the equipment was not only sanitized for each go, but the same token, our team members were practicing the appropriate amount of safety requirements, again, in line with the governor's orders, CDC, and Central Health. At that time, those first days, we already started to realign ACHD operations. We had a pretty good idea that this was not going to be a 1 week, 2 week, 3 week sort of thing. So what we did is start setting up rotational operations and asking our team members, our deputy directors across the board, to start prioritizing who, what, where needed to be where, who, and what at specific times, while maximizing the protection of our team members and at the same time maximizing our journey into work from home for an operation. As you can imagine, as I'm sure you've dealt with here, for a highway district with the responsibilities we have, that was a huge transformational challenge on how operations should be done. But our team responded absolutely incredibly well, and the commission was incredibly supportive of the actions that we had to take. Next slide, please. This is the strategy we approached, and I call it immediate plus one. And what this means is, as we dealt with the immediacy of what was thrown in front of us, we also dealt with what we thought would be the next step. So planning and executing both at the same time. In other words, we stood up our rotational and work at home operations and such, but we also began planning for our reconstitution, because at some point in time, this was going to take the next steps toward back to what I call the new abnormal mode of operations. So we didn't want to be caught short. So what the team did is we were standing up operations on this transformation of how ACHD does operations. We also started planning operations for how do we recover? How do we bring back the operation to, quote, full force? We deferred non-emergency operations immediately. And I'll talk a little bit about this, and I have a handout that I can leave with you that shows the specifics of what our maintenance operations did. We then, as we were instituting our reconstitution actions to bring back to normal, that's the immediate. The plus one was, how do we prepare now for what we thought would be another, in the future, another 2 months worth of operations? So we started to build a reserve kit that included a 60-day reserve supply of PPEs, sanitation equipment, IT equipment that has been put aside. It's locked up so that if this reoccurs again, we don't have to stand in line. We have the equipment and we have the support for our team members so that we can continue our operations without impacting the emergency responders or impacting supplies and stuff that would go to another round of this, which the experts say we'll probably be looking at again. Next slide. So we are this close to completing that list. Those are the supplies. Of course, it doesn't include the IT equipment, cell phones, TV, laptops, that sort of thing in excess of what we have now. But we charged maintenance to make this work. We will be complete by the end of this week. And these supplies, that 60 supplies I said earlier, they're put aside. They're not utilized. They're there in case another emergency occurs, which we believe it will, so that we can continue operations without having to stand down or having to impact the different hospital supplies that everybody else is using. Next slide. So team strategy across the board. We thought this was very, very important. First thing we had to do is maintain our team member confidence in the organizations. And so with the great support of our commission, we instituted there will be no break in pay, period, dot. We've got this covered. We will make sure that we have operations going forward so that it builds that confidence of our team members that were for health reasons, work at home reasons, family members susceptible. We covered them to make sure they knew that they shouldn't have to worry about bills from our perspective. We also maximized our business partner operations. Just a quick example, our cleaning crews that come into the district every night, they were very concerned that we were going to, based on the only person in the building is the director and 2 other folks, that we would be limiting their access. As a matter of fact, we increased it. We asked them to do enhanced sanitation or sanitizing in all of our buildings on a daily basis. What did that do? That kept paychecks going to their families and supported them. We also, again, in partnership with your staff on a couple of projects here in Boise, continued to push forward to make sure those projects were not deferred. And so we could continue to keep that cash flow going from the district back into the community so that we thought we'd be helping regarding the unemployment issues here. And so far it's worked out fairly well and such, and we haven't seen any huge pushbacks on that at all. In the very initial phases, that first month or so, it was very important for me and for the commission to have a daily update from me to all of the crew members across the board to let them know the good, bad, and the ugly. There were no secrets. There were no hidden agendas whatsoever. I laid out exactly where we were, what the operations were, what we would be looking at in the next couple weeks, days, or whatever, to again build that confidence so that we have that aspect of the team may be at home, but still part of the team. And so one of the things that our great communications team did, and I brought this display for all of you here, was do a mural of all of the team members that are working from home And these are displayed in all of our buildings right now, and that aspect of you may not be here, but you're really still here when it's all said and done. And there's a lot of great pictures of some interesting work at home scenarios and such that we wanted to make sure that we continue to circulate amongst all of the 370 team members at ACHD to let them know that, you know, they're all part of the group. As I said, we ensured full compliance with the Family First and CARES Act across the board and such, which is always a challenge and such as we work forward on operations. We then established an interesting quarantine strategy, again, assuring the safety of our team members. The CDC and other organizations have recommended if someone does test positive, you quarantine them or you ask them to quarantine. We said that would be good +1, going back to our immediate +1 strategy. So what we have established at the district is that if we had a member, and we've had very few, that was diagnosed as a positive test for COVID-19, we not only quarantined them, we then quarantined as a precautionary issue the members that they had been in contact with. So as you can imagine, from an operational perspective, that could become devastating. So what we did is we broke the teams up to do that rotational aspect. So no full team was ever in the same vicinity of the other part of that team during, again, rotational operations. One of the examples I'll give is our traffic maintenance team. It would be devastating to have ground the entire traffic maintenance team and then not respond to an operational issue that occurs all throughout Ada County. So they're broken half. They're on 1 week. The other team half comes on the other week. We're still able to maintain a majority of our operations, but at that point we continue to minimize the impact that an unfortunate individual might have regarding a COVID-19 positive test on the rest of the operation. It is a little bit frustrating at times. It is a challenge when it comes to a leadership and then execution strategy, but having invested in the work at home operation and the telecommuting operation, we haven't really seen that much of an impact other than our members are somewhat upset that they have to go home as a precautionary matter. We recommend, based on CDC requirements or recommendations, that go get a test. You come back negative, you're more than happy to come back. But again, precautionary wise, we want to make sure that we don't have an operation which shuts down all of the Ada County Highway District if we could have prevented it by just taking that extra conservative step when it comes down to this pandemic. Next slide, please. Impacts. As I'm sure I heard the boos and hisses from all the cities that we weren't doing chip sealing this year and such. That was a difficult decision, but it was the right decision, and I'm glad we made it because we would be in the middle of this right now, which we could not have sustained when it came down to all of the recommendations, requirements, and the safety issues that have gone through all cities at this point in time. What that did provide us, though, is an opportunity to go back and start addressing the projects that have been that have been in arrears based on all the other things we have been doing. So you're seeing a huge push through all of Ada County right now on a sidewalk type operations, fixing different things across the district. We have an opportunity now, since our paint teams are not tied to our chip seal teams, to go out and do enhanced crosswalk, school zone, restriping, those sort of things. And again, we have a full push on the maintenance backlog. I did bring this presentation that we gave the commission a couple of weeks ago on exactly what our maintainers are going to be doing for the rest of the season here. And I'll leave these here if you're so inclined to take a look at those. But I think you'll find that we have a huge task in front of us to wipe out that backlog of smaller projects. And I think we're going to get there on that. So that's the trade-off. We did lose sometimes some temporary appointments through our temporary help agency. We've brought a lot of those back. And we did, unfortunately, at some point have to kind of curtail our intern program. and such, which we have brought back. And such, we have a very robust intern program at the Ada County Highway District, and these were calls that we made in the best interest of everybody's safety across the board. One of the impacts, again, is we've established new pre and post safety inspection requirements for all vehicle operations. Vehicles are sanitized prior, vehicles are sanitized after utilization on a daily basis. There are new safety protocols that each of their team members go through before they step into the vehicle, both from a mechanical side and from an operational side. And this adds a little bit of time, but at the same token, it's that conservative approach to best ensure that we're doing everything we can to support Ada County and the state, and of course, safety for our people. And then we have required new standard operating procedures for team meetings, both on site and via Zoom. I mean, it's replicated right here in City Hall, but safety meetings are a little different right now. Pre-departure meetings are a little different right now. And the focus is on how are we being smart in all operations, and of course safe for our folks across the board. Next slide, please. Just a couple things we've done internally. When you come back to the building, you'll notice it's changed a little bit. There's a little bit of corridor operation and safety operations that we've installed to ensure the safety of all of the public and our team members. Next slide. As you have here, we have glass partitions everywhere. And such. I think we cornered the market on plexiglass. Next slide. For our commissioners, we've established these plexiglass dividers and such, again, taking that extra step to ensure their safety when they are in session. They are not in session now other than Zoom and such. Next slide. And of course, we have a lot of these on all the conference tables and such. So sometimes you're like a gerbil in a cage, but it works. Next slide, please. Operational impacts. We've already talked about that. Next slide. With that, that's our update, and I'll stand for any questions that you might have.
Thank you.
Madam Mayor, Madam Mayor.
Madam President.
I would just like to take this opportunity quickly on behalf of the commission to publicly recognize and thank Director Wong for his exceptional leadership through this uncharted time. He and the entire ACHD team have really done an extraordinary job with seamless pivots from phase to phase. And he's right. From day one, they were ready to go, pulled the pin, and have just not missed a beat since then. So I just wanted to thank him on behalf of the commission and give him a little bit of recognition today. So thank you.
Welcome, Mallory Wilson. Thanks for being with us today.
I think I'm okay to take this off so we can hear what I'm saying for a second. Let's see, let me get this. So is that okay? Yeah. So good morning. I'm Mallory Wilson. I am the city's new emergency manager. We have instituted an emergency management program here in the city fairly recently. So this has been an interesting time for, as everyone has said, but I think especially for myself being new to the city and new to a pandemic. So I'm just going to do a real high level overview of kind of where we've been as a city. So Madam Mayor, Council President Clegg, I would offer up to please jump in if there's something that you would like to highlight that I haven't captured on these slides. And so we will go from there. And I will say, as we move through this, that this, I mean, really has been a citywide effort. I think it has been exceptional the way that people across the city have stepped up to work together on this, to figure out planning, especially as we kind of talk about kind of this initial go at kind of some of our operational response planning. Unfortunately, we didn't have a continuity of operations plan in place prior to this event. It was on the docket, and then kind of that effort was in the works, but it wasn't completed. And so we kind of had to go through a bit of a coop sprint to respond to this as a city and as departments. And I think we did a really great job as a city and as departments in identifying some of our essential services and what needed to continue and what we needed to do. And it really has set us up excellent, I think, for the future to continue in that continuity of operations planning so that we are ready if and when another event that impacts the city in this way happens. So what we did kind of early on as we were looking and seeing that COVID was definitely going to be in our community and impacting our city and our city's service delivery is that we looked at determining what those essential service delivery areas were. You know, what did we need to be able to continue to provide services to the citizens of the city, and what could maybe be deferred or looked at and delivered a different way. So each department kind of determined those essential services or essential functions, if you will, and split them into kind of 3 tiers. Some must do, some should do's, and some probably can be delayed things. So that was kind of the initial cycle that we went through, is looking at what do we need to be doing. And that was kind of in early March, before we had even seen our first case here in the area. From there, we kind of looked at, and so I'll say that those kind of services, essential services were determined, you know, did it have an impact on public safety? Was it going to be a big safety impact to the employee? Because we wanted to make sure that both the public and our employees were staying safe through this. So weighting those kind of factors went into determining what was going to be an essential service for this duration of this incident. From there, we kind of assessed, is it something that could be delivered remotely, or is it something that needed to be in person, and what precautions would need to be taken if that was the case. And then kind of those wraparound support requirements to support both those ones that were in person and remote. I will say it was very beneficial that our IT department had rolled out Microsoft Teams just a little bit prior to this incident. So I think we were all Teams and Zoom experts at this point, but I think it was really crucial to the success of our kind of internal departmental response to be able to really embrace and use that technology to continue to do the work that we are able to do. And so really over the course of about a week and a half or 2 weeks, we transitioned most of the city's operations to remote. You know, there's a couple of things that had to kind of remain in person. Some of the field staff and obviously our public safety personnel were still kind of out in the community doing their job. But other than that, most of the city services that needed to continue were able to go remote within that kind of 2-week time frame. And so you can see there's a little bit of a timeline here. Wendy with our innovation and performance team put together a couple of timelines that I think are really great kind of graphics just to kind of show almost how quickly we moved through some of this stuff. Initially, we had kind of put our closure planning into 3 phases, but then as we saw cases come into the community and come in, you know, what we thought was rather quickly at the beginning, we kind of sped through our closure planning to get everyone kind of demobilized from in-person operations to those remote operations. And so then and we'll get into some of the other aspects of our response, but kind of along this frame, you know, along these lines, when we saw the cases decline and we were looking at what reopening was going to look like, you know, we looked at what the White House had put out, we looked at what the state had put out, we looked at kind of our needs and decided that we were going to align ourselves with the state's Idaho Rebounds, that 4-stage plan that the governor put out, kind of both for internally within our departments, you know, as city services, how are we going to return to work, and also externally as far as the service delivery that we are providing to the citizens. And so both of those frameworks, I didn't put them on here because they're a little busy, but they are on our website and easily accessible. But we did align them with that state plan in the 2-week timeframes. One of the key successes, I think, in this from a city standpoint was we centralized our logistics function. Normally, departments kind of handle a lot of their own supply procurement. And so we kind of centralized that because certain PPE and cleaning supplies were hard to find. And so Rob Bosefield and his crew really did a great job of developing a system to make sure that we could get the supplies we needed and that they were distributed to the departments kind of as they needed. They were making up supply cleaning kits because they couldn't get what we would normally use. We also have put in reserve a stockpile of some of our PPE and cleaning supplies, kind of as you mentioned, Director Wong, that if we do see supply chains be impacted in the future, we have a bit of a reserve to be able to continue our operations based on the stage that we are in, given that it's hard to procure stuff. And so with that, we moved through the stages kind of in line with what the state did, and now are obviously back with stage 3-like operations in line with what Central District Health has done. That's a little review of some of the policy actions, just so that we can all kind of remember what we've gone through here. March 17th was when we did the official disaster emergency declaration. I believe the first case we had in the county, I think, was maybe on the 13th, because I remember it was a Friday the 13th, which seemed a little foreboding. And then since then, we've had, I think we are up to, I think legal and probably helped, but emergency order 20, 10, 20, every 10, something like that. I think it's 10 of them. But so Mayor McLean took the forward-leaning steps early on to close bars and restaurants and put a social distancing order in place a little bit ahead of the governor's orders. And then from there, our public health order, emergency health order is kind of aligned with the stages of the governor's reopening, always kind of having a couple of additional requirements for those business protocols, social distancing, group sizes, and some of the stuff at the airport, just being a little bit more strict requirement over the recommendation that had been in some of the governor's orders. And then obviously most recently we have the facial covering requirement that is in place right now. So what I talked about before is a little bit of kind of how we approached things as a city and with our departments. We also knew that there were needs in the community that we needed to address. So we put together kind of a program, if you will, kind of in a project management framework to make sure that both the internal needs of the city and some of our external needs were being coordinated. And so from that, we had 8 work streams that we developed to kind of group the things in. Vulnerable populations kind of being the largest chunk as far as our external programs go. I'm sure everyone has seen the homelessness response. That team put together a really great plan working with the shelters in that community to ensure the safety of that population, to include being able to isolate and quarantine folks at the Cottonwood Hotel. We have our City Emergency Operations Center in kind of a spun up role. Mainly we work with interfacing with the county's Emergency Operations Center and their emergency management function there. Economic recovery, we'll hear from Sean later. Really looking at working with the business community and making sure that we're doing what we can there. Community health, our public messaging and communications, making sure we're sharing, amplifying the good stuff that's been happening during this, getting the appropriate messaging out. So those 4 are kind of our external facing work streams, if you will. Then we had a couple of internal stuff too, to make sure, again, that as a city internally, we were responding appropriately. So looking at staffing redeployment. When we went through that kind of COOP sprint, some service delivery wasn't an essential service. And so we had some staff that maybe didn't have a full workload or weren't able to do their normal job. So we looked internally at how we could redeploy staff to assist in areas that needed it, that were ramped up because of COVID. Organizational health. Making sure that our employees were feeling connected to the community, connected to the city, connected to their work teams, and making sure that everyone was healthy as a city, and as employees, not just doing the work, but personally making sure that everyone is okay. Organizational recovery kind of speaks back to those frameworks we talked about, and that Kyle put together those amazing reopening and closure plans. And so that organizational recovery is kind of that walking through those stage plans and making sure that we are in alignment with the governor's plans, with what Central District Health has put out, and that making sure internally that each stage looks as consistent across the departments as it can for those service delivery areas. And then, of course, you talked a lot about some of your funding and, the cost. We have a group that has been looking at the various reimbursement options and what the costs to the city have been and where we can get reimbursement as necessary. So moving on to kind of where we currently are, a lot of those work streams have actually transitioned back to kind of their normal operational day-to-day functions. There was a lot of initial planning and coordination to get things spun up, but as we stabilized a little bit while our cases were lower, we're able to get that stabilized and move it kind of back to a normal function. What needs to continue as we are now seeing this additional increase is continuing that work with the vulnerable populations community to make sure that their needs are being served. Our external coordination with various partners with the County Emergency Management Office continues. And again, that organizational recovery. If we do have to see any more regression in stages or additional closures, or as we move back into reopening, we want to make sure that we're still doing that in a coordinated manner across the city. We also obviously are looking at some contingency planning for the future. What haven't we thought of if we continue to see increases, if we see outbreaks in certain areas, what as a city do we need to consider and be ready for? So continuing to look at some of that contingency planning. And then I'll finish with a couple of highlights of some great things that I think we are doing. One is our public works team has been monitoring our wastewater data since May. And this is a kind of an interesting, a new look at some of the COVID data. It's shown that you start to shed the virus, into the wastewater, maybe even before you start to show symptoms. And so if you can see that data ahead of time, you can potentially predict some changes in trends. And so it's still new and we're still kind of getting the early data from it. And so we've been sharing the data with Central District Health and been using it, but it's just one piece of this larger picture. But it is definitely an interesting look at where we are in the community as far as COVID incidents. It doesn't measure cases specifically, but it's really good at looking at trends over time. So that's kind of an ongoing effort, and I think there's going to be more to come this week from that. And then the last thing is our library staff have been really great throughout this. They have spun up a sewing operation and we're making cloth masks for city employees. And now they're going to continue to make some cloth masks, and we are going to look at being able to hopefully connect with some of those vulnerable population groups and provide some cloth masks to those that are homebound, economically disadvantaged, might not be able to procure a cloth mask otherwise. So that team will be working with Shirley and our community partnerships team to try to connect some resources to those in need. So with that was all I had. I didn't know if there's any questions or if there's anything Mayor or Council President wanted to add.
Well, I just would like to acknowledge, as the director did, our staff. I mean, this has been unprecedented times, and what each of our team members have shown is that we are able to address a pandemic unlike anything experienced in 100 years, run the city at the same time as we are responding to community need and building partnership to meet those needs, and strategically work to reopen businesses and jumpstart our economy. So really appreciate all the work that's been done by our team, by the City Council, who have been great partners in the policymaking. And while we've got tough days ahead, I'm optimistic because we have such a great team that's shown how to juggle it all at once and do what we need to do for the community. Thank you.
Madam Mayor, if I could just say one thing, I'd say this. Mallory left out, or she talked so briefly about the part of the city staff stepping up to address the needs in the community. I don't know if all of you realize how important that was, but our homeless community and other members of the community that were in dire need at the beginning of this crisis really have fared better than many others in many other communities. And I really believe it's a result of our staff's hard work, coordinating with the service providers, coordinating with others stepping up, providing hotel rooms and doing other things like that to make sure that those folks could socially distance and have a place to be safe during this very difficult time. So I just wanted to recognize the staff for the hard work they did on that. It was pretty amazing.
Thanks. All right. With that, why don't we move to the next item? We'll have Sean Keithley and Mark Lavin are joining us to talk about small business expansion and support. And director and members of the ACHD Commission, we've talked together about the importance of supporting businesses as they reopen, as we hope.
Madam Mayor, could I, before we go on to the next topic?
Yeah. Sorry, I didn't see that you had unmuted. Sorry about that, Commissioner.
Oh, no, that's fine. I thought maybe it's more appropriate to have a couple of comments by commissioners and council members at each item rather than wait to the end.
I agree.
I just wanted to build on Council Member Clegg's comments, acknowledge the tremendous work the staff of both agencies have done. But we as policymakers have been given something that I would consider both a challenge and a blessing in disguise, and that is we have tremendous inequities in our country and even in our community. And this pandemic has exposed those. There are inequities of health, inequities of transportation and access to transportation, economic inequities. And I think the challenge as policymakers, it's not our staff it's going to do, it's us as policymakers. What are we going to do about that? Are we going to just let the curtain close again and proceed as usual? Or will we change and make some really hard decisions? And I think those hard decisions need to be made. I think there's an opportunity to do this one-on-one with other leaders in the community and not just go back to normal, as it were, and pretend like those inequities, which we are seeing, which those of us with a lot of privilege can see a little bit more than we have perhaps in the past. And so I would challenge us to use this time to develop some policy changes to address those.
Thanks, Commissioner. Anyone else before? I don't want to cut you off before we move on.
Madam Mayor.
Go ahead.
Thank you, Madam Mayor. I just want to amplify what Commissioner Hansen has stated. I believe that we're in a moment of profound opportunity, even though it's a great challenge with what COVID-19 has brought upon not just our city and county, but the world as we see. And I agree with Commissioner Hansen that now that there's no denying the inequities that exist in our community and how some people have already been living in crisis, this just adds insult to injury. And I myself am committed to that. I know that the city of Boise is committed to that and always seeking ways to improve. While we're thanking people, I would like to thank the Idaho statesmen. Early on in this pandemic, they reached out to me to ask for information about how they could get COVID-19 related information out to the community, to the Spanish-speaking community. And reporters like Nicole Foy, who focused on Latinos' lives in Idaho. As we know, as we've learned, there are certain segments of our population that are more vulnerable to the effects of COVID-19. And the fact that we do have people in our community who immediately, from the very beginning, made sure that populations like that community had the information that they needed to come out on top at the end of this pandemic. I think we have pockets of that where people have really stepped up to the plate and made sure that the most vulnerable members of our community were taken care of. So I think we have plenty of role models to follow, and I look forward to embracing this opportunity. Thank you.
Madam Mayor, this is Sarah.
Yes, Commissioner.
Yes, thanks. Hey, I'm gonna have to leave, but we this morning got an email, and I don't know if you got a copy of it, from Dave Crick regarding Sidewalk Cafe expansion proposals. I don't know if you're gonna be getting to this later but it is related to COVID. So, I mean, it makes sense to just bring it up now. I'm gonna have our director forward it on to you. I think it's important to keep the economic aspects of this whole shutdown in place also, and this speaks directly to that. But I didn't want to leave before this was brought to everyone's attention, because we just got it this morning, basically right before the meeting started.
Great, thanks, Commissioner. And actually, that's what John is planning to present on. I don't know if it's in direct reference to Dave Crick's email this morning. However, our goal, and so I think this is a great segue. I'm sorry you'll miss it, but we'll follow up. Our goal as a city council and administration, we've passed a resolution encouraging as many efforts as possible to support small businesses as they reopened, recognizing even before we saw the surge here, how important it was to have open spaces and create additional space for businesses in order to reopen and stay open. And so while we've been able to do this on 8th Street in a partnership with the businesses there, our staff has been receiving applications from businesses around the city that would like support. And I know that the commission has some preferred alternatives. We have some preferred alternatives. And my hope is that from this presentation, we'll actually be able to agree on a couple asks that we can make together of the state and other agencies that we need to partner with in order to provide this opportunity to businesses throughout the city.
Okay.
Great, thanks. Sean, go ahead.
Okay, thank you, Mayor, for the introduction of some of the salient issues there. Thank you, members of the Boise City Council and Ada County Highway District Commissioners. Thank you, Director Wong, as well, for your excellent presentation, and thank you for your partnership. I'm just going to open up our slideshow here.
I'm going to interrupt you just for a second. Someone on the Zoom, I believe, is not muted. So will you please just check to see if you're muted?
Okay, I'm going to kick things off here. Oh, sorry. Okay, sorry about that. So it's our privilege to be here today to present some information, as the mayor said, providing some opportunities for small business expansion here in the city of Boise, and also to highlight some of the ways that we can leverage our partnerships with agencies such as the Ada County Highway District and others that have a stake in allowing businesses to expand in the public right-of-way. So a brief overview of the issue at hand. The Idaho Rebounds Protocols for Reopening, as adopted by the Boise City Council and through our various orders, has allowed certain eating and drinking establishments to operate if certain measures are taken to mitigate the spread of COVID-19. And these include, but certainly aren't limited to, submission of a plan for reopening to the local public health district, establishment of certain protocols to maintain physical distancing of at least 6 feet, limiting interaction between patrons and staff, and a host of other protocols. So while businesses have been doing their best to implement these protocols and protecting public health and acting as responsible business owners, the simple math of the 6-foot separation between patrons has significantly reduced seating capacity for most establishments. So this physical distancing, while a great thing, and while accomplishing what we need to do to limit the spread of COVID-19, the bottom line is that it reduces seating capacity in most establishments, both indoor and outdoor. So to help meet that challenge, the Boise City Council on May 19th, passed Resolution 202-20 in the interest of supporting and empowering local businesses, including restaurants, to operate safely and profitably. And the actions that were directed to staff as part of that resolution included identification of areas where businesses could potentially expand into the public right of way to use this additional space and enable physical distancing. Second, to work with stakeholders such as the Ada County Highway District and the State of Idaho Alcoholic Beverage Control to increase outdoor footprints, as well as ensure compliance with any relevant laws and maintain connectivity and mobility along the public right of way. And then finally, to review city licensing and permitting standards to determine which standards might be temporarily waived to help enable some of these goals. So potential solutions that came about as a result of this objective that was spelled out in the resolution included the expansion of seating into the public right of way. And this includes a number of different scenarios that Director Mark Lavin will explore in a moment, but a few of them include expansion of the furnishing zone for sidewalk cafes, expansion into on-street parking lanes, commonly known as parklets, or closure of travel lanes, which might involve the closure of a portion of a street to enable expansion of outdoor space. This is similar to what was done on 8th Street recently, which provided something of a template for us looking forward to expansion of this concept to other areas of the city. A second element of this expansion includes the expansion of patio areas into adjacent private open space, such as plazas or surface parking lots. Today, we'll be focusing on the right-of-way component more than the private open space opportunity, but we wanted to highlight that as well as another way to accomplish this goal. So in light of the resolution that was passed by City Council and the opportunity that was presented for businesses to expand, to date, the Downtown Boise Association, which supported the efforts of the city in conducting fairly extensive outreach to the business community to solicit proposals for outdoor patio expansion, we've received upwards of 90 separate proposals from businesses for expansion into the public right of way. And this map just denotes roughly where some of these locations are, which involve a number of different scenarios, including all three of the scenarios that I mentioned earlier. And Director Lavin will provide a little bit more detail on what some of these scenarios look like and ways that the city can help work with our partners and leverage those partnerships to accomplish the goals of potentially using this public right of way to support expanded space for businesses.
Good morning, Madam Mayor, Ada County Highway District Commissioners, Boise City Council, Director Wong. I'm Mark Lavin, Director of Planning and Development Services at the City of Boise. And this is some preliminary work that our staff has been conducting in our comprehensive planning team with staff at ACHD. So the first option really is the easiest, the longitudinal expansion, keeping sidewalks open, no impact on parking, but may require some businesses to work with neighbors if they elongate a patio seating area in front of an adjacent business. So that's a simple and desirable solution that we're going to try to get that accomplished in as many incidents as we can. The second option, Sean referred to this a little bit earlier, is a parklet expansion, which so you have the patio seating, sidewalk, and then in an adjacent parking stall or two, you can have additional seating. It does reduce your on-street parking capacity. However, it does keep your sidewalk open in ADA compliance, which is good. There may be no impact on travel lanes, but that needs to be worked out with ACHD. The significant issue here really is the open container and, compliance with alcoholic beverage laws. But it still remains an option, something that we need to work through. Third option, and you'll see this on 8th Street, is the sidewalk expansion. We actually just extend the patio cafe to the full depth of the sidewalk and then reroute the sidewalk into the street. It again reduces into the street parking, I should say, but it does reduce on-street parking. It's used to be a detour. There may be some slight impact on travel lanes depending on buffering of the lane. But it does, the challenges here is you can create a little bit of a mismatch of sidewalks and coverage, and it can be a little circuitous in that regard. But again, there are going to be opportunities where it can be clean. And then the fourth option we have is just a partial or full street closure. Again, it impacts the entire right of way between the businesses. Requires extensive traffic control. And just some examples of this would be very lightly traveled streets like the Basque Block and Broad Street between like 4th and 5th. So those are the options. And so what the next steps is the comprehensive planning team is going to process kind of the site-by-site requests, evaluate and select the lowest impact option for the expanded area, develop temporary traffic control plan if necessary, and then we'll be coordinating with the ACHD Development Services staff to obtain approval. We get approval, then obviously we'll move into implementation and just continue to monitor and refine the process as we can. So that's it for the presentation. Any questions?
Madam Mayor?
Yes, I can't see who that is, but please go ahead.
Oh, well, I'm sorry, this is Commissioner Arnold. I had some technical difficulties this morning, so I was unable to sign in on my iPad. So I had to call in, and I'm going to have to leave the meeting in about 5 minutes. But I wanted to say thank you to Director Lavin for the presentation. I totally agree that it's very important to provide support for our businesses. The one concern I have, caveat, is that we have to assure that we comply with the Americans with Disabilities Act, and we have to assure that those who have disabilities are able to have access into and through those areas. So, I mean, that's the one thing I would say, please keep that in mind as we go forward with this.
And that is definitely part of our review, Commissioner Arnold.
Madam Mayor?
Okay, thank you.
Thank you, Commissioner. And take care. Yes, is that Commissioner Goldthorpe?
Yes. I just want to interject here some of the same concerns, but also a concern that I have that for reasons of confusion between the authorities of the various agencies, city and ACHD, that there seems to be so many of the small business, in particular the restaurants and bars, that don't know who can grant them this kind of waiver. And so anything I would offer, and I don't think anyone will argue it from our end, anything we can do to help provide information and direction. We're sending people to the city when they contact us. But as far as I'm concerned, minus the ADA aspects, I think we ought to be doing everything we possibly can to accommodate these various scenarios that have just been outlined. Thank you.
Madam Mayor, this is TJ.
Hi there.
Hi. In looking at these three scenarios, I certainly support one of them. I just want to ensure that there's success in achieving this objective. The concern I had with 2 and 3 was just whether we're putting folks eating out into the street or sending pedestrians out into the street. They both seem like safety concerns to me, even though it's where a car would normally park. And so that's just my overarching concern with 2 and 3. And maybe I'm missing something, but I really want to see at least one of these be successful. So thanks for the hard work on this.
Madam Mayor, Councilmember Thompson, that is something that we would be working with ACHD on is if you did a parklet as an example, there may be some required lane buffering in order to ensure that safety. There would be barriers in between the traveled right of way and the parklet itself. So all those items, there's a process that we need to go through and ensure that safety, but that is paramount.
Madam Mayor.
Yes, go ahead.
Thank you. Councilmember Thompson, my experience at Idaho Smart Growth, we've worked on parklets now for the last 5 years, and we've instituted those on a number of streets, not just, they started on 8th Street, but we've done them, frankly, all over the downtown. And as long as you have a barrier on the street side, we haven't encountered any issues with those in terms of safety. I know this is more permanent, it's longer term, but if you have something visible, vertical on the edge of the parklet, I think most people are smart enough not to drive into it.
Thank you.
Now, certainly people can lose control of their cars, so it has to be sturdy enough that you're, accounting for that. But for me, it's, I think if we can overcome the regulatory barriers, we can figure out the safety.
Great. Thank you.
It looks like
Madam
Commissioner-
Mayor, sorry. Sorry.
Madam President, go
Go ahead.
ahead. And then
okay.
President May, and then Commissioner Hanson.
Okay, I just wanted to thank both gentlemen for the presentation and voice my support totally for helping to do whatever we can in way of partnering with the city to help revitalize these businesses that have been hit so hard. I did have a conversation with Jen Hensley from the Downtown Boise Association. Elaine and Holly and I are on that in an advisory capacity, but she was saying that the list continues to grow. And when I spoke to her the other day, of course, it includes 8th Street, but close to 100 businesses. So again, for the reasons stated, I support everything that's been said and look forward to making something happen to help all the businesses. So thank you.
Thanks. Looks like somebody on a phone would like to talk. No, just unmuted. Okay, Commissioner Hanson.
Yes, thank you, Madam Mayor and President May. I would strongly encourage us to move these quickly. The tendency is to become a little bureaucratic and then the season goes by. I am confident that with the experience we have at ACHD and the city ensuring ADA compliance, because the law applies to all public agencies, and to ensure safety of people using that space, we can do it. The challenge, of course, from our agency's standpoint, always comes from, well, we rely so heavily on level of service, which is the convenience of a driver at the peak hour. And that we get a little bit nervous about what might be or perceived to be a slowing down of commute during the peak hour. And that might, in fact, cause our staffs not to move forward on some of these 90 requests because we might have a couple frustrated commuters. We don't use economic return of businesses as a measure to counterbalance this level of service. And so I think in this time, we should do that. We should counterbalance that with the success of the businesses, because those very businesses, if they can stay open, they can succeed and have healthy patrons, they stay in business and they pay taxes, and that's what we rely on. So I think it's very important we learn from this experience to use the tools, the measurements, the metrics of business return against the level of service which we are so reliant on at our agency. it's a unique circumstance in Ada County because these are two different agencies using different measurements. So I would really encourage our staffs, if there's some question, to bring it on up to the policy level and not to dispose of a lot of these as saying, well, it's just going to be too impossible.
Madam Mayor,
Yes, I didn't see who that is, but go ahead.
this is Steve Price, General Counsel for the Ada County Highway District. I just wanted to remind our commission, as well as the council and you, Madam Mayor, that we have a master license agreement for the downtown that gives the city the authority to regulate and sublicense facilities within the public rights of way. And the downtown area has been expanded, so it most certainly encompasses the area of the 90 businesses that applied. Our review of that is really the applicant goes to the city, makes a request. We review the plan. We only review it in terms of traffic safety and operation, as well as ADA and compliance with other laws. So the city has more control of the functioning of the sidewalks. We simply just do a simple check, which does not take us long. The purpose of the agreement was to reduce the amount of bureaucratic layers and to let the city define the aesthetic character of their downtown community. So I just wanted to remind you that that agreement's been in place for several years. It's been expanded to parklets, sidewalk cafes, as well as valet parking. And frankly, I can't imagine there being anything else that's being proposed that wouldn't authorize the city to administer that program. I just thought I'd bring that up.
Thanks. Thank you. Council President.
Thank you, Madam Mayor. So a couple of points, I guess, if we're going to move this forward. Council Price, I appreciate that you brought up the master license agreement. I guess from my perspective, what I'd like to see, and this is in response to Commissioner Hansen's request that we try to do this more quickly, is that perhaps the commission could consider a resolution similar to the City Council's resolution that would give their staff permission to waive some of these in light of the economic crisis that we're facing and the COVID crisis that we're facing. You can determine what to put in there. In ours, we put permits and licensing, but there are things that you as a commission could empower your staff to do more easily and more quickly if you would be willing to consider that. I think that we'd also like to see us be able to do this as one big request and not one-offs, so that we can just move forward with it. And so if there's a way that within that master license agreement or within the resolution that you write, we can figure out a process by which the city can just bring a big bundle of all of these, and then we can work on them one by one once we get that approved, rather than bringing them one at a time and having to do that approval one at a time. I think that would slow it down quite a bit. And then finally, as I understand it, there is an issue with the Alcohol and Tobacco Bureau about open containers if we use the Parklet model. And I believe it would be helpful if both of us, again, could perhaps pass a resolution, but then go arm in arm to the state and ask for them to temporarily waive that only when these very special conditions are met. And our staffs, I think, have worked on what those conditions would be. So from my perspective, if we could get agreement to pursue those things today, I think we could move forward on this a lot more quickly.
Thanks, Council President. Well said. I agree with your assessment of the steps that ought to be taken, especially when it comes to, I think it would be very powerful for us together as two agencies to approach the state and ask for partnership in very strict circumstances. But we also, as a city, would have to look at some things around open container, and that's for the Parklet solution. And while there are other options, I think there are quite a few applicants that have proposed Parklets because they are on busier streets, and this would be a way to keep the streets open, but to take advantage of some of the parking spots to expand their areas. So I don't know if we ought to take action on that, but we can't see all of you, but I do think it'd be great from the council side of things to just get a sense of, yes, this is how we should proceed. And then I don't know, President May, if you want to ask the same question of the commission, just so that we can be sure that if there are next steps, we take them rather quickly, because businesses are definitely waiting. And I think this is an incredible opportunity to show partnership and help with economic recovery, reopening, and support of very important institutions throughout our community.
I would agree. I think, Madam Mayor, that I believe I heard a consensus among the commission members. I know a couple have departed, but I'm seeing some head nods here that we could move forward on exploring the language for something like that. Mr. Price, this would probably fall into your wheelhouse to explore the language for the resolution, but I would like to see us move forward on that so we can expedite something.
Madam President,
I think I see council. Oh, sorry, was that?
That's Steve Price.
Yeah.
Oh, great.
Madam President, I'm sorry.
Go ahead, sorry.
I'm happy to go ahead with the resolution. If the city could send me the language from that would be helpful, and we'll get right on that.
Madam President.
Thank you, Mr. Price.
I'm seeing nods from our staff. We'll get the city council resolution sent over to ACHD. And then I would ask, it looks like there's a couple people that want to talk, but I'd also ask our staff, both Director Lavin and Sean Keithley, as well as others that have been part of the memo that was proposed, just to work with ACHD staff to see next steps with regard to approaching the state, and then with the DBA and other applicants to see how we can bring forward one large application package.
Perfect. And thank you, Mr. Price.
Great. Council Member Halliburton.
Madam Mayor, thank you. And I would like to thank the commissioners for their support in trying to streamline this process and working with the city of Boise to help these local businesses. I just want to make sure that as we are streamlining this process for all of the businesses in the downtown area, that we're also making sure that we are streamlining the process for businesses who may not be in the downtown area, who may be trying to do things in parking lots or other things like that, so that we're creating the same opportunity and pathways for them as well. But fully in support, and thank everybody for jumping on board.
And Commissioner Hansen.
Yes, actually, Councilmember Halliburton actually took the words out of my mouth. I think it's important. We probably need some sort of dual resolution, one that basically clarifies the existing agreement with respect to downtown. It looks like we probably don't need to do much, but that we should have a consensus and a resolution with respect to providing that for businesses out of the downtown area. There are quite a number of streets, Orchard, Vista, and others. And it's very important that those businesses be given the same sort of opportunities when working with the right of way.
And I'll ask our staff, because I agree, and we wanted from the beginning to make it clear that this wasn't just a downtown initiative. And with but working with the DBA, there's been kind of an organization that's put together the different places. But from the city team, we've heard from businesses throughout the city, correct? Or has it primarily been downtown where we've received requests?
Yes, Mayor, we've received numerous inquiries across the city, primarily in downtown, but it has been not exclusively downtown.
Okay. Thank you.
Madam Mayor, I would also add that a lot of expansions that are occurring in other parts of the city are actually done on private property within a shopping center. Since everything's street facing downtown, I think that's why we're seeing this collection of applications from downtown.
Excellent. Well, I think we have direction for both the city and ACHD staff in terms of next steps. So we'll thank everybody that's been working on this and really look forward to being able to present a solution to the public together so we can get moving on this. Thank you. All right, next up we have from ACHD, Director Wong, a presentation on the traffic calming project for Harrison Boulevard.
Okay, thank you, Madam Mayor.
Madam Mayor, before we jump on to that next thing,
Yep, go ahead.
Sorry to interrupt, Director Wong. I just wanted to bring up something that Commissioner Hanson had brought up a little bit earlier, and I think this is kind of an opportunity as we look at the different areas around town that would be super easy to implement some of these things. We think about the Live District, we think about 8th Street, we think about the Bass Block, and part of that is because of the way the sidewalks are set up and sort of the use of universal design in those curb cuts. Especially when we're talking about ADA, being ADA compliant. And so I just wanted to make sure that I took the opportunity to address maybe the potential for some long-term policy considerations. We certainly don't need to do it right now at this meeting, but to see the advantages of having those universal design curb cuts when we're looking at other streets in downtown areas or other spaces in the events of making things like this easier.
Thank you. And then I see Commissioner Hanson, your hand is raised. Oh, great. All right. Unraise it so that next time you want to talk, I won't think that it's accidentally there. Great. All right. Director Wong.
Okay, thank you, Madam Mayor. We have had multiple concerns raised by the residents on Harrison Boulevard, a major collector regarding speeding and traffic issues. Let's go to the next one. There we go. Nope, one back, Stacy. There you go. And so we've had long-standing concerns on dual speed limits. We had, I guess there was one out there for trucks, one out there for cars, growing traffic, safety for all users. Of course, these speed signs and stuff are not prevalent in Ada County. It's another county next to us. I won't name the one. And such, but it came to a point where we wanted to do something, and the commission wanted to do something about this. So we came up with some interesting ideas on how we would proceed next as a pilot project, again, based on the neighborhood wanting to go down this path. This is a recommendation. This is an idea that we brought forward and will continue to work on. And such, but it is no way in any stretch or means a decree that this is what we are going to do to Harrison Boulevard. Next slide, please. So we are approaching what I call a hybrid solution. First off, the low-hanging fruit was kind of easy. Standardize the speed on Harrison for all users across the board. We found it interesting that we actually had one set of speed limits for heavy vehicles, one set of speed limits for cars. It didn't make sense. We immediately changed that, and it's a standard 25 miles per hour at this point. This was incredibly well received by the Harrison residents. However, as all actions, you have this side and you have that side. We received many less than complimentary comments from citizens who use Harrison Boulevard to get to the foothills or back into Boise. They did not like the idea of lowering the speed limit. We also received some concerns from residents on 15th, the street right over, because they were concerned that the street now would become more of a thoroughfare based on us lowering or standardizing the speed limits on Harrison. We really haven't seen that at this point in time.
Excuse me, what's the difference in speed limit between 15th and Harrison?
There isn't.
Okay.
No.
They're both 25?
Yes, they just thought that the issue would now of us lowering the car speed limit from 30 to 25 would cause
make people, okay.
Go to the others.
Gotcha.
We haven't
Thanks.
seen that yet and such. The second option, we wanted to address the infrastructure. Was there something we could do that was effective, efficient, cost effective, and something that we might be able to model for other streets in other parts of the community, not just in Boise, but in the other 6 cities that had a similar series of current infrastructure challenges to move on. So what we did is we came up with this idea. Next slide. It is a spin on chicanes at those 4 intersections specifically. We have taken no positive action at this point in time, but if we can address the issues at these 4 intersections and produce not only a speed limit issue, but a visual cue to all drivers, all users, we might be able to slow the the speeding down and make it safer across the board. Next slide. So here's our plan. Here's our thought. We're looking at a concept of installing swale beds on parts of the road and expanding the center areas out so that drivers of all users have got to do sort of a turn to come into those areas. We found in the past this slows drivers down. We found in the past it is a safety enhancing issue. We found in the past that again on major projects that this tends to work out very, very well. That being said, we've never done this before. And we think that Harrison Boulevard, again, being a major corridor, which has its own challenges and its own policy issues, and such as Data County Highway District, might be a great opportunity to test this out to see if it works. So next slide, please. Here's where we think we want to go and where we've been at this point in time. We have briefed the commission on the concept. And again, it is a concept at all. We have met with the neighborhood association president and presented this concept to him. We intend to conduct open houses, and if the residents of, which is most important, the residents of Harrison Boulevard agree that this is a good idea, we'll continue down this path and we'll execute it and such. And as I said earlier, this could be a possible template that we can, I won't say quickly, but easily put in as opposed to doing major construction and ripping up roads and again costing taxpayers a whole lot more than it would be to use this program. It might be a win-win. If the neighbors don't agree, then we'll bring back their concerns and recommendations back to the commission. We'll do additional studies and reviews and see if there's something else out there. But this is an absolute hybrid, but it is and we want to continue the resident collaboration. Next slide, please. So this is the proposed timeline of what we are looking at. Again, it's a concept. And in August, a robust open house, and then we're going to have a confirmation from Nina as whether or not they think it's a good idea or they don't think it's a good idea. And depending upon where they go, if it's a go, we'll move forward with the next steps in the concept. If it isn't, we'll come back to the commission, ensure that the residents' concerns or ideas are broached, and we'll go back to the drawing board and see if there's something different than we can do. If the residents are in agreement, then in September, we'll continue to review with Nina on the steps forward and bring it back to the commission, both on design characteristics and our focus is in March to make it happen. And so again, this is something that we'd like to try and see if there's a consensus from the neighborhood. And we do believe that if we can go down that path, then that might be an economic solution that we can institute in other like areas, not only in Boise, but across Ada County, again, as we all work toward traffic mitigation, safety, speed control. So in a nutshell, that's what we're thinking. And we wanted to share that with you. Again, our focus is if the neighbors agree, great. If they don't, well, we'll go back to the drawing board.
Mayor?
Council President.
Thank you, Director Wong. This is exciting. This is, I'm glad to see opportunity to try some things. I guess my reaction is maybe this is an opportunity to actually get some data on different solutions. And so I guess I like what you've proposed. Wonder if why you chose this. I guess my first question would be why you chose this versus a typical curb bulb out at the crosswalk. Do you have any data that shows that this might or might not be more successful than that?
Again, this is something that the candidate, our engineers and our team and our design says, let's think of something unique. Let's see if there's something there that not only can support safe operations, but at the same time, not do much damage. When it comes down to, again, corridors like Harrison, like the other major corridors we have, and by damage, I mean not having to rip everything up and start over. I think with the implementation of increasing the opportunity for stormwater containment out there, where those sort of bulb outs were, that's
That's where a lot of the drains are.
yeah.
Yeah.
And so, you know, it's something we'd like to try.
Yeah.
But again, my focus is, I'm sorry, the commission's focus is that neighborhood has got to be in agreement with this. If they don't, okay, we'll go back and think of something different.
So if I could follow up, so then my follow-up is this, one way that you can get neighbors in agreement without doing something permanent is doing a somewhat temporary demonstration.
Mm-hmm.
Have you thought about doing that? You could use rubber curbing and put these out there next week, frankly, leave them for 3 months and gather data and see if they actually slow people down and get a reaction to it. You probably can't do that because you haven't done any outreach, but I'm just saying, I wonder,
with the neighborhood,
wonder if
no.
it makes sense to try it
Yeah.
actually on the street. Once you get agreement to try something
Mhm.
and then gather data around it, you could even then play with design. You
Sure.
could do one chicane, one bulb out, see if there's any difference. Just wondered if you'd thought about that.
As a matter of fact, we have a conversation next week with a group of citizens from we're going to sit down and talk about how we can do temporary traffic mitigation speed issues. We have already, I think it was last summer or whatever, we actually did put hay bales
Yeah.
out.
At
and such,
Longfellow, yeah.
But what's most important is we want to make sure that the neighborhood is fully vested first. If I go out there and just put something out there, it'll be a disaster. And you'll hear about as much as I'll hear about it. But my point, though, is that all options are on the table. And again, Harrison Boulevard and all roads, of course, but Harrison Boulevard being very special, as we've done in the past for Halloween, closing that down to ensure that we have safe operations for kids. We'd like to try this.
Yeah.
And we'll see. But again, if the residents are not on board, then we're going to have to think of something different, because I won't move forward on something that the residents are up in arms about and saying no.
Thank you.
Madam Mayor.
I think that was Councilmember Bajent.
Yes. Thank you very much for the presentation. My only feedback or thought to throw into the mix is that with this street and this neighborhood, I think the neighbors that you're talking about getting on board include more than the residents of Harrison Boulevard. It's, I mean, it is an important street to people who live there. It's a very important street to people who live from 18th or 19th down to 15th or 12th. And it's a very important street for people who live on and north of Hill Road. And so if you define the neighborhood too narrowly and just talk to people on Harrison Boulevard, I think you'll get one perspective. But as you mentioned at the beginning of your presentation, these things have pushes and pulls in both directions. And the number of people to whom Harrison Boulevard is very, very important as a connectivity corridor, as a way of getting to and from where they live and work and, you know, live their lives, is much, much greater than just the people who live on Harrison Boulevard. And so it's more work. But, those are the
Councilman, well said. Again, we will have a robust open house. And as you noted, we will be working with Nina across the board. But you are absolutely correct. There is never 100% support for all users on operations. It's a fact of life.
Commissioner Hanson, is your hand raised on this topic?
It is.
Great, thanks.
I just want to appreciate the director for raising this and invite the council to take a look at the project we did on Kootenai. Now, it hasn't been built, but it was an extensive process that was initiated first by just filling in sidewalks, but the neighbors got organized, collected signatures, and became aware of how important traffic calming or speed management on that road was. we get every day requests, what we call teleses, from people who have concerns about traffic. And I can almost guarantee you every day there's something about speeding. Now, often people will think that the only solution to speeding is putting up a speed limit sign or a stop sign or a speed bump. But really, it's, as Director Wong suggested, it's really in the design so that people don't feel comfortable speeding. We have a lot of streets in this city, and I'm very familiar with several of them and have raised this as community projects over the years. Nez Perce is a great example as a speeding cut through parallel to Overland. Another one is Burgesson down in southeast Boise. Now those neighborhoods are a little different than the neighborhoods along Harrison Boulevard or along Kootenai. And so what I'm going to invite the city council to do is take a close look and see whether you think maybe a more active involvement by the city on behalf of those neighborhoods, whether they have an organized neighborhood association or not, as to whether the policy we have, which is policy 5104.2 on traffic calming, that policy basically places the burden on the neighborhood to collect signatures if we want to move forward. Occasionally we move forward like we are kind of on Harrison without having them collect signatures. But most of the time you'll see the response from the agency to these neighbors who say we need some traffic calming on our neighborhood is, well, here's the process. And then certain areas, collectors and certain areas with certain speeds. So there's a lot of things that then disqualify them. So I would invite the city council to take a closer look at that policy and whether in fact we can address this on a more equitable way throughout the whole city so that it's neighborhoods where there might be a large number of rentals or people who don't have the time to go out and collect signatures or become nearly as involved. Their kids on their streets are just as important, and they're as entitled to have traffic driving at the speed limit. Speed limit signs don't really do anything. People drive the conditions, the way the streets are designed. And so that would be my remark. Is let's move forward on the outreach to the neighbors in Harrison, but also look at this as an opportunity for some changes in policy and approach in the way the city gets involved in ensuring safety. And when cars are driving, people are driving at the speed limit, it's safer to cycle, it's safer to walk, it's safer for people with disabilities to take their time to cross the street. We have a lot of benefits. In fact, it's often safer for businesses too to then function adjacent to those streets.
Thank you. I see nobody else raising their hand. Council President, did you have something to say in follow up to that?
I guess in terms of a path forward, it looks like ACHD is moving forward with this. I suspect our staff is already involved. Director Lavin, if not, I wonder if either the energized staff or the neighborhood staff could be involved in this. I know that there are other organizations in town that are interested in traffic calming in a bigger way. And perhaps, as I said earlier, this is actually an opportunity not just to take care of Harrison, but to pilot some ideas. As you mentioned, you'd like to be using them in other places. And it might be that even by this fall, we could identify 3 or 4 other places where we could pilot ideas like this or similar to this. And by spring, we'd have some data showing what's working, what's not, what's accepted, what's not. I don't know what the staff capacity at this point is. It's not my job to direct staff, but I guess from a policy standpoint, it sounds like to me a really good step forward policy-wise to get some data and test some of this stuff out.
I'm seeing nods from our development services director, planning development services director. What I propose is that staff look at the potential, if that's, and then again, connect with ACHD staff if ACHD is willing to have that conversation about whether or not there's potential for a couple pilots. Again, getting beyond the downtown core and really thinking about how we can support neighborhoods throughout this city is important to all of us. And I know my sense is it's important to the district as well. I love this proposal. I think it's a great step in the right direction because this street is impacted by people from so many different places. Would be curious to know as it moves forward, if it moves forward, to watch the impact on 15th and then determine if perhaps the same treatment isn't the right thing to do if we're saying that people divert. I tend to think that people just get used to the new cues that they see on the streets and will continue with the patterns that they have, but having that data is important. And then let's work with staff to see who has capacity, if there's capacity, and on the energized team to look at suggestions for where we ought to at least ask if something could be considered. And I live near those hay bales or whatever those things were on Longfellow, not on Longfellow, but near Longfellow. And I was always amused at how it was a great project to just see how it worked and to watch how people moved around them differently. It did slow down, and then just get a kick out of seeing people, even though it was so temporary, recognizing that something had changed and the impact that had on the way people drove on the street. So if we can do cheap projects like that just to collect some data and see if it works, how it works, and then look at what's next, it'd be great.
And Madam Mayor, as I indicated, we are meeting with a team of citizens from Boise.
That's great.
I believe next week to actually lay down okay, here's what we can do, and here's how we can study this. And so we're already walking down that path.
Great, thank you.
Mm-hmm.
All right, well, being mindful of time, I want to move into just the last topic, which is a quick check-in on frequency of meetings, any next steps that people have in mind that we haven't proposed. I'll just kick off and say that I felt that this was really productive. Look forward to partnering with the agency and on a larger scale solution for businesses in the time of COVID. And then also on this Harrison Boulevard project, and believe that there are others. I think it'd be helpful to, figure out and if President May, you have a suggestion, or President Clegg, you do, to figure out a regular meeting schedule, because then we can have a sense of certainty in terms of when all of us will come together to discuss issues that staff have compiled as important from a policy perspective. So then our staff continues to work, but that we can come together every now and then to discuss higher level policy issues to make sure that we're working together to deliver the best services for our residents.
Madam Mayor.
Go ahead.
I invite President May to follow up, but I agree. I think regular meetings would be great. I also wonder if it might be beneficial to those more regular meetings to have some leadership meetings in between to kind of discuss which issues are most ripe and where staff is on particular issues, so that we ensure that when those issues come to the larger meeting, they're the ones that we can actually take some action on. For me, I don't know if regular means quarterly or thrice yearly, but something in that range I think seems reasonable.
President May.
Madam Mayor, I would agree. I like the idea of having the intermittent leadership meetings in between and discussing what's timely and bringing those concerns and issues forward to set the agenda for the next meeting. I'm really impressed with today that we're actually leaving here with a consensus and an action item. So everybody feels that there was value added to the meeting, and I would like to see this partnering continue. My initial blush was maybe for sure no less than twice a year. I was thinking maybe quarterly might be too much, but depending on how events roll out, we may want to look at that, but certainly twice a year with some leadership meetings in between. And we can always adjust that, as things come up too, but that would be my thought.
Great. Well, why don't we do this? I think 2 to 3 meetings likely makes sense, especially if we include leadership meetings in between, but we could offline just have our chiefs of staff and staff connect on that, get a sense of the issues before us that weren't on the meeting today that we need to cover, and then come up with what makes the most sense for the next meeting. And in between then, leadership would come together to review the items so that the meetings can continue to be productive like this. Excellent. Well, thank you all so much for joining today, both those of you that are here in the building and those of you who I look at on the screen. And I share the council president's sense that this was productive. Look forward to working together more, to having our staffs connect as follow-up items, and then we'll be back in touch on a schedule. And so I guess we're officially in a meeting, so we need to have a motion on the city side to adjourn.
Madam Mayor, I move we adjourn the city meeting.
I need a second, please. We have a motion, a second. All in favor?
Aye.
Opposed?
Okay.
All right. City
Okay.
Council is adjourned.
All right.
ACHD.
We will follow suit. Commissioners, is there a motion to adjourn?
So moved.
All right, second. I think I got a head nod from Commissioner Goldthorpe. All in favor? All right, we stand adjourned as well. And thank you very much for hosting this today. Look forward to the
Thanks so
next
much.
one.
Take care, everybody.
Thank you.
Great to see everyone.